So Nora, you wrote that first piece that I showed on my laptop here from the Miami Herald. Talk to us about this lawsuit. Why is this program so controversial?
Well, I mean, these four doctors are suing OPAS or PAHO in English, the Pan American Health Organization, which is an UN agency, because they believe that the organization trafficked in human labor and benefited from what they deem as a scheme of forced labor. The problem is, this is the most controversial issue here, is that according to official documents, the Brazilian government was paying $4,000 to the Cuban government for each doctors, but from that, the doctors would only get $1,000. But then they even get the complete amount. They would get a part in Brazil, and a part would be retained in Cuba, and they would get access to that money only if they return to the island. So basically, they're saying that they weren't being paid what the Brazilian government was paying doctors from other nationalities that were part of the program. And also, they were complaining that they were curfew, that they were under surveillance by Cuban agents, that they could not travel freely. And we heard some dramatic testimonies in that press conference of doctors. One of the doctors said that the government was harassing her because she couldn't get her son to live with her in Brazil all the time, despite the fact that the Brazilian government issued a visa for her son. So afterwards, after she defected from the or abandoned the program, the Cuban government retaliated against her family and evicted her family from a house she built with her money. So there are many issues which are really controversial, but specifically, I've been putting this question to the Cuban government several times
Mm-hmm.
if they agree to be more transparent, say more about why that great difference between what they get and what they pay to the doctors. And I haven't been successful. They don't want to talk money.
Mm-hmm. And of course, that is
Mal-
exactly what everyone else wants to talk about. Go ahead, Arturo.
Malika, I think that it's important to put this in context because although I will not dispute any of the arguments that has been made by Mrs. Gamez, I think that it will be helpful if even in this program, but also in her newspaper, we make some references at the situation of the healthcare at the global level. And the WHO in 2010 even has to sign a voluntary code about the international recruitment of health personnel. And there is a reality that if you look at Cuba in its geographical context, in the context of the Caribbean, 3/4 of all the nurses that graduate at the University of West Indies that provide health care for 6 millions on the Anglophone Caribbean, 3/4 of these nurses emigrate to or are recruited. They not just emigrate. They are recruited by the United Kingdom, the United States, and Canada. So the reality is that, in my view, there are some evidence that are clear that the Cuban government relations with these doctors has been very asymmetrical, and some abuses it looks that happen. At the same time, you cannot look at this issue of the contracts and the type of agreement with PAHO without taking into account the critical problem that healthcare providers at the global level are facing critical situations like the one in the Democratic Republic of Congo, because among other things, there is a tremendous brain drain from developing countries to developed countries. So
Mm.
this context is important, and the international law and the code is voluntary, but express the ethics about healthcare provision in the world. And the reality is that the Cuban doctors in Brazil went there as part of a contract. It is an insult to call this slave labor.
Sure,
I
Arturo, if
think
I
those
may just
contracts are
add
asymmetrical. those contracts are asymmetrical without question.
So Arturo,
But
I hear you there. Let's
if I
give Nora a
may,
chance to
yeah,
respond because you
say,
gave her a
yeah.
recommendation of what should be in her articles and her paper. Go ahead,
Sure.
Nora.
And it's Dr. Gamez, Arturo, not Mrs. Gamez. But anyway, um, so I think no one is doubting first the quality of the Cuban doctors, and also like the international needs to provide healthcare. I think the issue here, and that's what the Cuban government needs to answer in particularly, it's why it was keeping almost 80% of what the Brazilian government was paying the Cuban doctors. The other question that they would need to ask is where that money goes. They have said that that part of the money goes to the Cuban health system, which is public, but then there's no really oversight on the fiscal budget in Cuba. So it's very hard to find out if they're really investing that sort of money on the island.
And Arturo and Nora, Arturo, before you get back in, I just wanted to share with our audience that the binary that we find you two in is also online, because Nesihan here brings up a point that you raised, Arturo. Nesihan says Cuban doctors and Cuba's healthcare happen to be the envy of most developed nations. Another person writes in on YouTube, coming to us live. They say that they've done amazing work throughout Latin America and even here in Portugal. We have many Cuban doctors working here in private hospitals. But on the flip side of that coin, you have people like Aiji who says it's still an example of slave labor. Yes, we understand that they have to be taxed back in Cuba, which is fine, but not 70%. The new Brazilian government should block that deal. And I'll read one more, Arturo. Rodrigo here says, this is a way for the Cuban regime to use foreign resources. The government pays almost nothing to the doctors that go abroad, but it charges a price for first world services, and it's not free. Arturo?
Well, I think that Dr. Gamez, I didn't mean any pejorative term when I call her Mrs. Gamez, but I will call her the way she wants. I think that Dr. Gamez is right when she called for more transparency on the accounts of the Cuban government. And I personally believe that, as I said before, the agreement is very asymmetrical. But notice that what President Bolsonaro say is 100% of the salary on the first day on his inauguration as president. If this is not asymmetrical, or in fact it's more asymmetrical than 20% or 30% and 70, 100%, I think it is difficult to argue that. And in reality, we need to take into account the minimal wage in Brazil, and we need to take into account the conception by which those doctors were sent to Brazil. In order to have a welfare state in Cuba, that I admit that has been deteriorating, and I would like to see more transparent standards to keep it, not to dismantle this welfare state. The reality is that you need to export some of these services, and with the money that you receive from that, provide some help for those who remain at home, and they are the ones that are making the same amount of money, or in fact, less amount of money than the nurses in Jamaica or the nurses in other areas of the Caribbean, that in a situation of an open market, where you have this invisible hand that the libertarian people try to promote, the reality is that 3/4 of these nurses left the country. Do I agree that we need to take into account the professional and the rights of the healthcare provider? For sure. But at the same time, I found that the coverage of the Miami Herald and many other news institutions that has covered the issue refuse to take into account the realities that are present in every single General Assembly of the World Health Organization.